in their care, no date had been set for them to receive the jab. Our Health and Social Care editor, Victoria MacDonald, has more.
Residential homes for people with learning disabilities are, it's fair to say, feeling aggrieved. Throughout this pandemic, they say they've had to fight for adequate testing for their staff and residents, for help when those same staff have had to self-isolate, and now for vaccinations.
I think right at the very top of government, there is no real recognition of people with a learning disability as being a very vulnerable, complex group. And learning disability individuals, all the way through this pandemic, have always cut their second fiddle, basically, to elder care. You can understand that.
Now data shows that in the week ending January the 22nd, 8 in 10 deaths of people with learning disabilities were COVID-related. Yet on the prioritisation list for the jabs, they are either placed at number 4 if they have Down syndrome or are clinically extremely vulnerable, and at number 6 if they are defined as having a severe and profound learning disability, an arbitrary distinction that those caring for them say should be removed.
What we're seeing is immense confusion as to what constitutes a severe learning disability. So there's no definition. A lot of people are relying on GPs to use discretion, and there's an awful lot of confusion out there. People calling GPs and getting different answers. If you include everybody with a learning disability, it's only another 100,000 to 200,000 people, which is basically 3 or 4 hours of the vaccination programme. So it's not adding a huge number of people to that.
Homes from Home Care has been at the centre of the fight to be treated equally with care for older people. Today, they say 5 of their homes have had no vaccinations at all.
One particular young lady was in hospital for 3 months not so long ago with pneumonia and sort of associated issues which relates to which causes epilepsy and so on. So these guys should really be absolutely at the top of the list, along with sort of older people as well.
In November, a Public Health England report revealed that deaths among those with learning disabilities were up to 6 times higher than in the general population, while those aged between 18 to 34 had 30 times the death rate of the general population. Today, the Health Secretary was asked why they aren't higher up the list for the jab.
The best approach is to take the clinical advice and to follow that clinical advice.
Advice that was provided by the Independent Joint Committee for Vaccinations and Immunisations, the JCVI, who decide who goes first.
After the break, America